Welcome to the Savvy Safety Sisters Partner in Prevention podcast. I'm your host, Carrie Pasquarello of Global Secure Resources. Now, we know one of the best ways to make a difference in preventing harm is to bring stories from around the world in hopes of bringing awareness to help keep you and your family safe. Now, we want to empower our listeners with education and advocacy by experts. So today, we're going to discuss a disease called CADASIL. Now, this is an important topic as it affects families worldwide and is often misdiagnosed, sometimes with MS. So let's welcome my guest, Dr. Fanny Elahi, Associate Professor of Neurology, Neuroscience, and Pathology, Molecular and Cell-Based Medicine at Mount Sinai. Now, she's a physician scientist with a doctorate in neurogenetics. Now, she has a special interest in genetic diseases such as CADASIL. Her groundbreaking research will hopefully pave the way for much needed treatments and cures for diseases like CADASIL and other forms of dementia-causing diseases. No, I know this was a quick introduction, so there's so much more to say about you, Dr. Elahi. But I thought it would be great to ask you to share a little bit more about your background with our listeners. So thank you so much for joining us today.
It's such a pleasure. Thanks for inviting me to join you on this podcast. Um, my passion is really to understand why and how brain starts degenerating and ultimately losing function that leads someone from a state of being independent and living their life as they wish, having control over their mind, to no longer being able to perform what they love, interacting with their environment, and gradually sort of losing control of the functions of the brain. A second thing I'm passionate about, and I can't tell you why, is the small blood vessels of the brain. I would say that for a long time, I thought about aging and why different organs start malfunctioning, and many roads have led me to believe that the input and the output of the brain, or the barriers of the brain, are a key component of brain degeneration. And as such, CADASIL, which is a disease that primarily affects the brain's blood vessels, or vessels actually, input and output, may be an incredibly important disease to study, to help those affected, but also to understand really fundamental mechanisms that take a brain from a state of function to dysfunction. There are aspects of this disease that could generalize to other neurodegenerative diseases, such as Alzheimer's disease, Parkinson's disease, frontotemporal degeneration. And as a genetic form of disease, and maybe we'll get to cover that, studying CADASIL presents with great advantages with respect to approaches that we now have available to us that can help us tease different processes apart, like a puzzle, put a picture together, and start thinking about how we can reverse the problems and preserve brain tissue.
Wow, that is a lot of information. And I'd like to jump right in to really have you explain what CADASIL is and how it typically presents in patients for those who are unfamiliar with, this type of genetic condition.
Yeah. So CADASIL is an acronym for cerebral autosomal dominant arteriopathy, subcortical infarcts, and leukoencephalopathy. This helped no one understand what this disease is. It's a very long, descriptive terminology that refers to all the different, in a scientific jargon, it refers to all the different components of the disease. So I'll take them one at a time. It's autosomal dominant, and what that means is that changes in one gene, mutations in one gene, can cause disease. So this can be inherited in families. if the mother or the father carry a mutation in this gene, the gene is Notch3, they can pass it on to their children. So on and so forth. And so it's autosomal dominant. One change in the genome suffices to cause disease. It affects the blood vessels of the brain, arteries to be more specific, it's in the terminology. And what that does is that it can lead to strokes, small little strokes. Often this is lack of blood flow. So there are tiny little clots in blood vessels that prevent blood flow to a certain region. They're called lacunar strokes, small strokes, but it can also be bleeding. It's less common, but it can also happen. So both lack of blood flow and also rupture of the small blood vessels and bleeding. But I would say by far the most common presentation has been sort of these non-specific psychiatric problems, maybe depression, anxiety, other forms of not being oneself, not feeling great, migraines, migraine headaches, really bad ones, or just headaches. It's a really large spectrum. Problems walking, and a whole slew of other kinds of presentations. What helps the diagnostician or anyone think of CADASIL is that if you present with symptoms with and without history in the family, because sometimes, these things were even less well understood and less well diagnosed. So it's possible that no one in that person's family had received the diagnosis. But if someone has, say, migraine headaches and they present to their physician and they do a brain MRI, imaging of the brain, and see really profound changes of the white matter of the brain, this is a red flag, and it can start a workup for that patient. Now, ultimately, we have an incredibly great diagnostic test, which is genetic testing. So at the very first suspicion, the test can be sent, and whether they have a mutation or not in the clinical context can lead to a diagnosis. So one of the obstacles for CADASIL is that it's not it's not very stereotypical. Not everyone looks the same. Not everyone has the same symptoms. But the white matter changes of the brain can be the reason why the genetic test is sent.
So what are the biggest challenges in diagnosing CADASIL early, and what steps can patients and doctors take to improve this early detection?
If I had my way, we would screen everyone. We would diagnose before symptoms present. And eventually we may get there. If we have treatments, when something becomes treatable, then there is willingness to screen early and prevent symptoms in that individual if there's a very good treatment for that condition. At this point, most of the treatments are symptomatic, and as such, actually many people don't want to know. And so screening is really not an option. I would say if there is a stroke at a young age that is not explained by other phenomenon, and maybe I'll take it a step further and say if someone is having young stroke, even if they have high blood pressure or other reasons for having bad blood vessels, if they have changes on their MRI that could be consistent with CADASIL, this test should be sent. If they have migraines and a family history of migraines, and again, with the white matter changes on the MRI, this should be considered. And if they have a family history of early or young onset neuropsychiatric problems, I think this test should be considered. Because despite the fact that I've repeated multiple times white matter, white matter, white matter, there are some individuals who have CADASIL and don't have white matter changes.
Oh, interesting. And so then how does that go in with, for instance, misdiagnosis with other neurological diseases like MS or some of these other diagnoses?
I get a lot of referrals from my colleagues who get sent patients to their clinic. These are MS specialists for MS, and once they see them, they're really not convinced, and they send them to me. And more often than not, we have actually found that they would have CADASIL. So one of the reasons why they don't think it's MS, it's the pattern that they see on the imaging and the story. There's usually some sort of vascular event, either transient ischemic attack, which didn't end up like in a stroke, but there was lack of perfusion to a part of the brain, or a stroke at a young age. And so a good diagnostician, a good neurologist pulls all the information together, and if that patient's clinical picture doesn't fit the criteria for MS, they almost immediately think of other conditions such as CADASIL. They sometimes send the genetic test and then they send them to me for care, or they refer the patient to me, and I do the genetic workup. One of the, I think one of the things to consider is how comfortable people are with a genetic diagnosis. If they are comfortable with a genetic diagnosis and there are concerns, if there are any of the signs, right? Migraines, changes in behavior, psychiatric symptoms, or neurological, and strokes, any of them, you don't need all of them, then CADASIL can be considered.
Interesting. So then going into like managing symptoms, what are your suggestions or the current approaches towards improving the quality of life for patients once they are diagnosed with any of these types of disease, whether it's MS, dementia, CADASIL?
What I do at this point, because we don't have what we refer to as disease modifying treatments. These are treatments that alter the course of disease by specifically targeting pathologies in a given disease. That comes when enough of the biology has been understood and we know what to go after. We're not there yet with CADASIL. This is why I have a research lab. This is why I put so much effort into research, because we're not there, but we really ought to get there because we have the tools to do this work. So we're really pushing hard on that front. While we're doing that, I see patients in clinic and I want to be able to help them, even if it's not substantially, because I don't have a disease modifying treatment. I want to slow down or prevent maybe events if I can by modifying vascular risk factors. So there it's falling back on all that we know is good for blood vessels and or bad. Avoid what is bad. Exercise in ways that we don't fully understand is really helpful. And it's not just cardiovascular exercise. I always encourage patients to do strength training or resistance exercises where muscles are also strengthening, and the muscles attached to the bones are impacting bone health. And so it's a very holistic approach. Not just good for blood vessels, just good for health in general. And what's interesting is that this is an opportunity for CADASIL. CADASIL is very sensitive to environmental factors, so non-genetic factors. You can actually alter course of disease by being a very healthy person. So exercise is one of them. Not smoking is another one, which thankfully less and less people do in today's society with all that we know is bad about smoking. I usually say a healthy diet, and I don't prescribe specific kinds of foods, but we know, high levels of simplified carbohydrates or sugars are not good. So moderation, and limiting that. Saturated fat, limiting that. Having enough fresh fruits, enough vitamin input, everything that we know is sort of healthy. And again, we've come a long way to realizing what is good for health or not. That helps. And then the hardest thing actually is stress. And unfortunately, the biology of stress would suggest that it's really bad for CADASIL and a trigger. So there I have a longer discussion with my patients to try to understand their life a bit. And at that point is sort of thinking with them what can be done to reduce stress and what are the measures that they can take to protect their brain by modifying their life to sort of accommodate for this increased risk or vulnerability to stress.
And that sounds like a lot of really great ideas for everybody. So more exercise, eating healthy, reduce or don't smoke, reduce alcohol consumption, and reduce stress, right? So all
Right.
of those key ingredients for our brain health and body health are
Okay.
all.
So I didn't mention alcohol, but we can add it, right?
Right.
I would say we don't know how alcohol impacts blood vessel health. And there I say everything in moderation and nothing in excess. What we do know is that with age, the brain becomes very vulnerable to alcohol. So as patients grow older, then maybe a higher limitation on alcohol intake would be advisable. But all this to say that we just need more research in CADASIL because we need to be more precise. It's not very satisfying to sort of just throw all these measures and expect the patient to live the perfectly healthy life to protect themselves when we have so many different drugs and so many other treatments. And if we had really convincing data for all of these measures, like quantitative data, where we would say, look, you would reduce your risk by this much or that much, that would also be more satisfying. So while we're working on understanding the biology of disease so that we develop treatments that could be game changing, we also are actively working on how can we set up clinical trials that test these same measures, some lifestyle measures and some existing medications. There are many medications that are available for other conditions that we could repurpose and test to see whether they can actually slow down progression in CADASIL. So this is another line of work in the lab that we're pursuing very much collaboratively with other researchers and clinicians across the US.
Right. So that kind of goes right into recent advancements in research and potential new treatments on the horizon for CADASIL. Do you have any like breaking today?
I cannot wait to come back to this podcast and tell you about breakthrough treatments. I can't tell you how urgent the need to get there is and how hard we're working, but I would be lying if I said that we have definitive game-changing treatments. We don't. But what gives me hope and gets me out of bed in the morning to do the work is that the steps to getting there is mapped. We are not, meeting to say, what do we do? How do we go about this? We know how we need to go about determining. We just need to do it. And we've started the work on discovery of the biology. And I would say over the past several months, we have started thinking what will be the drugs that we need to do clinical trials for, and what would the clinical trial look like, and what will be the outcomes. And we're working with a sense of urgency on that front as well.
Wonderful. It's so great to have you on the front line on all of this. So thank you for all your hard work that you're doing daily in this realm. But how does CADASIL typically affect a patient's daily life? And what advice would you have for patients and their families to manage these challenges?
It can affect people in all sorts of ways. And I would say that it's hard to say that depression and anxiety are symptoms of CADASIL because they are so common in society. But if someone has a notch, so there are symptoms to be treated, regardless of whether it's genetic or not. And so I take them very seriously. So those are things that I can modify in clinic, right? So if someone's mood is low, if they are struggling psychologically, if they feel anxious, all of those we have good medications for. And I would say to go to pursue treatment, to not ignore these problems because they can have quite big impacts on one's life. When we don't feel well, we don't engage with the environment to the same extent. We can't implement these healthy measures in our life style, and our brain just functions very differently. So you get in this sort of negative feed forward loop. So I think mood and how we feel really matters. And then I'm gonna just use the stories and the statistics that we know about CADASIL. There is a slowing in thinking, and that makes sense biologically because the covering of the neurons, which helps the speed of conduction of information, gets damaged. This is why we see those changes on brain scans, and this can cause some slowing in thinking. It doesn't mean that people can't think. It again comes back to stress. It means that at their best, they could do better than if they are rushed or if they don't feel good and they can't sort of recruit their brain to the same extent in tasks. So sometimes this means changing one's job to accommodate for a different level of speed needed to do certain things. There, as things advance, there can be what we call executive dysfunction. So it's hard to multitask. There's a little bit of distractibility. This is not ADHD. It should not be treated with the same medications as ADHD. These are all just presentations of their symptoms of the biology sort of progressing. And again, I think some mindfulness exercises, some acceptance that I can still function, I just need to accommodate, would go a long way. Understanding of one's friends and loved ones to sort of help the patient would also be very helpful, as opposed to sort of stressing them out, getting annoyed, and so on and so forth. And finally, migraines are also very treatable. Not for everyone, unfortunately, to the same extent. I do have some patients whose migraines are really refractory to many kinds of treatments, but it's not very common. So pursuing care for headache and migraine can also help extensively, because when we have pain, our brain is offline. There's very little that we can actually do with migraines.
Sure. And I like the point that you brought up that, anxiety and depression and, migraines, these are common symptoms for many people, not just with CADASIL. And I think that would give a little bit of hope for the patients with CADASIL, knowing that they're not alone, that there are other people that are suffering the same symptoms, but go and seek treatment. Right,
Yes.
for these things, so that they can have a better quality of life and be able to interact with the world in a better way. So thanks so much for bringing that up. That's such an important point. And so, what are your ideas with proving and increasing awareness of CADASIL and support for those affected with this condition, and also how to avoid being misdiagnosed? Do you have any ideas about this?
Yeah. If I may, I love how you put it. It brings people out of isolation, because there's this sort of genetic disease where you feel like you have this condition. It's rare. You're by yourself in there, but really, CADASIL is a vascular disease, and aging by itself is a vascular disease, if you speak to me. And so, I think connecting with others dealing with the same symptoms and experiences really brings people out of isolation. And one of the things that we're trying to do is to create support groups, peer support groups. And sometimes our patients are in other kinds of support groups for other diseases and diagnoses, and they find that to be very helpful. So that's one thing. The other thing that I just wanted to mention is that I'm really passionate about also advancing understanding of women's trajectory of brain health and disease throughout life in a lifespan way. And there's something that happens in women's life, which is menopause. This is a pretty drastic physiological change, endocrinological change midlife, much earlier than men sort of go through. And this can impact brain health and also well-being, how we feel at that stage in our lives. And so women who have CADASIL can seek the same exact care as women who don't. And there is nothing about CADASIL that should preclude someone from seeking advice, counsel, and a discussion about hormone replacement therapy. Again, that clinical trial has not been done and really should be done. But short of that, I would say that the biology of what we understand and is emerging in CADASIL suggests that there's a vulnerability of the blood vessels, and hormones, especially estrogen, is really important for function of blood vessels. So despite the fact that through other kinds of mechanism, there's an increased risk of clotting of the blood, and so people are worried about that, and that CADASIL has this sort of stroke risk, the two may not be the same, and there may be still benefit from hormone replacement therapy. So I really want women who get diagnosed with this genetic condition to still pursue that discussion with their provider to see whether whether the benefit outweighs the risk or vice versa in order to make an informed decision. The other thing is about pregnancy and how that should be handled. I think the diagnosis should be shared with the provider, but again, the care is the same, and maybe they just are under tighter surveillance, and symptoms may be taken more seriously because of the increased risk of stroke, but they can still have children. And many, many, many of my patients do have had many healthy and happy pregnancies and deliveries. Now, coming back to, or do you mind repeating the question? Because I wanted to add this to the last one and I forgot your question.
Oh, just about how to avoid misdiagnoses.
Got it. Very hard question. It's a very, very hard question. I would say the best is to seek expert opinion. I think the list of possibilities is changes on imaging, white matter changes on imaging, zero symptoms. If they're just white matter changes on imaging at a young age, for whatever reason that imaging was obtained, they can pursue the sort of workup. They can seek expert care. They can see me, other people around the US who are familiar with this diagnosis. And then this is where the expert opinion comes into play, because we take a lot of different things into account and have that discussion with the patient of, this is the probability, would you like to pursue further? And then if the migraine is refractory, if there are other things other than migraines, either complex migraines or again, some family history that could be concerning, they could pursue care. Avoiding misdiagnosis is, I don't know how to respond to that because it happens so often. And I think the best way is for informed patients to sort of seek the workup, and ultimately it's a genetic test, right? So with a genetic test, it can be ruled out if there are no changes. Sometimes the result of that genetic test says variant of unknown significance, which is very unsatisfying. What that means is that there is a change in the gene, but the clinical significance of that change has not been determined in another human being. So it could be disease causing, but we don't know. And that's where I think the future of diagnostics, which we're working on, is going to be helpful. We're developing secondary tests that can be done in order to be able to determine that. I won't get in the details of that, but this is not just a problem facing CADASIL. It's a problem for all genetic disorders, where there are some that we have studied and understood, and there's some that we don't yet understand well. And I think at that point, it again comes down to the clinical judgment, and that's where expert opinion comes into play. Personally, I look at the change. We do modeling in silico, theoretical modeling of what that change would mean for the function of the protein. And then I take the clinical context into account. And then I say, look, I can't know 100%, but this is what my expert opinion is, that you do actually have CADASIL, and that this genetic change is probably causative. But ultimately, it's all about a sort of a probability estimation.
Right. And then I guess it just comes all back to awareness, awareness for doctors, but also awareness for patients as you're going and having these discussions with your doctor. You have to be your own advocate, your medical advocate, being able to kind of help with understanding from what I've understood and the conversations that I've had with numerous people, is when they're going and they're sharing the diagnosis of CADASIL, sometimes in the medical field, they might not have heard of CADASIL. So once again, it's that ability to be able to bring awareness about this, and just doing your research and your own investigation, and then working with your team of doctors and the people who are there advocating for you as well, on the medical side. So it definitely is a team effort to try to get more information. And I once again am just amazed at what you're doing on a daily basis to put CADASIL up there in the spotlight, and developing all these new ways to look at the brain. I'm just really, really in awe over what you do. But we are at the end of our time today. So I want to ask if you have any last words, or if there's anything else that you'd like the audience to know about CADASIL or your personal journey in finding help for others.
Well, thank you so much. First of all, thank you so much for doing this podcast on this topic. I just want to maybe finish by saying that I feel very strongly about partnering as we move forward on the journey of transforming how diagnoses happen, finding game-changing treatments. This is not just the scientific team or clinicians working. We have this project that we're doing at Mount Sinai in collaboration with a few other sites, where we have a really tight partnership with patients and their families. And I have learned tremendously. So I would love to continue the dialogue with whoever is affected with CADASIL. Contact me by email. I don't know if you're providing that, or through my lab's website. There are many ways to get in touch with us. We want to hear from you. We would love for you to participate in our research, and to move forward from a time where so many are getting misdiagnosed to a place where diagnosis is no longer an obstacle, and then we have more precise treatments. And I give it a few years so that we at least become more precise with regards to what we think hurts or helps CADASIL, and then a few more years to having some treatments specifically developed for CADASIL. Thank you for doing this, Carrie.
That is just remarkable, and gives so many people hope about CADASIL and the trajectory of what's going to be happening over the next number of years. And I feel confident having a person like you working on this mission that we are going to be finding some wonderful pathways forward. So I just want to say thank you so much for joining me in this mission to raise awareness about CADASIL. And as we mentioned earlier, there is no cure for CADASIL yet, but this is why awareness is so critical. And I'm really hopeful that one day we're going to discover treatments, therapeutics, and drugs, and develop a toolkit that can help discover more impactful strategies to detect CADASIL and intervene early, before cognitive decline or behavioral changes have begun, because we need to intervene early to save the brain before the degenerative process begins, correct?
Absolutely.
Yes. And so
Very well.
until we find the cure that's needed, we'll definitely put a focus on the supportive care, including emotional support, counseling, which is very helpful for those affected and their families. And so that's it for today. And we'll be back for another episode to increase public awareness about topics faced by citizens in their daily life, whether traveling around the world or the corner. And be sure to visit us at globalsecurestudent.com for more information about our community awareness and prevention programs. And I'll be sure to add resources and links to learn more about CADASIL and the doctors' fabulous work that's taking place on a daily basis. I'll make sure everybody has all the information to connect with you. So thank you so much, everybody. Be safe, and we'll see you at our next podcast.
Thank you.